Good morning, everyone, and thank you for having me here today at the board meeting. I want to go ahead and introduce myself and what I'll be presenting. My name is Lacey. I'm here on behalf of Liberty University, and today I'm going to be presenting about how your school can become a trauma-informed school and what that looks like. So I want to first start off with a statistic, just because this puts it into real perspective for some people. More than 2/3 of children report at least one traumatic event by the age of 16. So that's a pretty big number. And you as a staff can help reduce the traumatic events or have some sort of knowledge of what these students may be presenting or exhibiting if they are dealing with trauma. Going forward, so some impacts and effects that can affect your students that you could probably recognize as a teacher or a faculty member is some cognitive and learning impairments. Some children have the inability to concentrate on schoolwork or what's being presented in the class. Some students show some poor memory. Zoning out of class is very common as well. Struggles with reading and some math. You will definitely see increased days of school absences in these children most likely. And you will probably see lower grades and a lower grade point average. Some effects and ways that trauma can impact children and students go way beyond what you may see at school and what they're presenting with at school. Some of these things are emotional impacts, like having mood swings or having depression or dealing with anxiety. Some physiological impacts, like being hyper alert or having headaches, is common. There's also behavioral impacts like impulsiveness and neurological impacts like changes in their brain development. So what is being trauma-informed? Being trauma-informed is an approach based on knowledge of the impact of trauma. This is aimed at ensuring environments and services are welcoming and engaging and safe for service recipients and staff. So to our students that are teaching and to the staff, we want to make sure that we are being trauma informed for both. Some principles of trauma informed care is safety, trustworthiness, and transparency, peer support, collaboration, and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. And so I want to kind of talk more into about one of these principles, and that would be safety, because safety is actually the first important step in creating a trauma-informed environment. We want to ensure that our students and our staff feel physically, emotionally, and psychologically safe. And if they do not feel safe, we definitely want to address that. Again, this is the first important step in creating this trauma-informed environment. If our children aren't feeling safe at school, if our staff isn't feeling safe at school, how are we making that a trauma-informed environment for both? So what can your school do to implement a trauma-informed environment? Some things that you can include is provide some ongoing training and professional development days for your staff. These training days can present on chronic stress, trauma, and cultural competency, just for examples. There's a million other things that staff can be trained on. In particular, can be trained directly towards being trauma informed, you can take trauma informed training classes. But these are just some other topics that you can hit on with your staff and administration. You could also review policies and procedures to ensure that they are reflecting the understanding of trauma. That's one of the most key important things that you as a school can be doing. Your teachers can, and your administration can establish a continuum of academic and non-academic supports and interventions. So this is meaning you can provide an after-school program or a mentoring program for students who may need it. This could provide not only a safe place if they don't have a safe place to go to after school, but also provide them some intervention that they may need. Some other things you as a school can be doing is you can be establishing social and emotional skill building and learning activities. So your teachers and your staff can get creative in trying to figure out ways that you can implement these skills into lessons that you're teaching. Some other few things that you can do as a school to ensure this trauma-informed environment is you can establish administration and staff buy-in for creating a trauma-informed environment. You can develop or identify an existing team to plan and coach trauma-informed approaches. So you can have certain individuals within the school who do the trauma-informed training who will then coach other administration or other teachers. As well as you can do this throughout the board and just make everyone take the training. Lastly, and I believe this is one of the most important things that you can be doing as a school, is I believe that building partnerships with community agencies is especially important. We want to be able to know what our community has out there, what resources we have for our students. If our students are struggling with something that the school isn't going to be able to help with, it's important to be able to know what resource we have in the community so we can refer them or let their parents know or let them know individually. So yes, building partnerships with community agencies is a huge one that schools could be doing to create a trauma-informed environment. So lastly, I want to discuss ACEs and what it is and how ACEs may, you're probably wondering how or why ACEs are even being considered or being talked about today in our presentation. So I want to start off with what ACEs is exactly. It is adverse childhood experiences, which are potentially traumatic events that occur in children from ages 0 to 17 years old. And so we want to know, how big is this problem? How big is ACEs? ACEs are actually very, very common, more common than you would expect. 61% of adults reported one traumatic event happening before the age of 18. 61%. That's a big number. Not only that, but ACEs are costly. They cost the community a lot. They cost the health system a lot. If we had a 10% reduction in ACEs, there'd be a savings of $56 billion throughout the United States. And again, some children are at greater risk for these. And these are mostly racial and ethnic minority groups that we will see have a higher risk of having an ACE or scoring a big number on an ACE. So you may be wondering how you at your school can be preventing ACEs. Again, going back through what I talked about earlier about reviewing policies and procedures to creating that trauma-informed environment. One of these is creating family-friendly work policies. So making sure that our work policies are family-friendly. So we're not putting our child basically in the hands of someone that could traumatize them. We can have public education campaigns. You can have an ACE, these ACEs, or what ACEs are, you can have this campaigned throughout the school. So not only is your staff being educated by it, but also your students. You guys can implement social emotional learning. So again, trying to incorporate some of these social emotional skills into the learning is beneficial. Mentoring programs, I mentioned that earlier. These also prevent ACEs. Again, like Big Brothers, Big Sisters, I know it's not connected to schools, but these type of mentoring programs help young individuals who are needing that mentorship that they may not have at home. And again, after school programs. So providing a place that's safe for children who don't have a safe place to go to after school necessarily. Like if they don't have, if they can't be home alone, having that after school program for these children in place is beneficial to preventing an ACE. So again, thank you for coming today. And that concludes everything. If you have any more questions on ACEs and how they are relevant to the school and how they're relevant to having a trauma-informed environment, you can see me after and I can definitely give you more information on that. Take care. Bye.